Hey everyone, welcome to another episode here on Doctors Go Live with me. I am Nina Shahrukh Khan, and today we are going to be talking about breathe easy, understanding allergic rhinitis and sinusitis. So, who's tuning in right now? As usual, let us know where you're tuning in from and what would you love to learn in today's episode, and where are you guys tuning in from? All right. So, of course, what is it that you guys would love to know and learn in today's episode? Breathe easy, understanding allergic rhinitis and sinusitis. Let us know in the comment section. And who's excited to win some prizes? Because today, if you share this video out, tag people, you get to take part in our Doctors Go Live quiz happening right here at the end of the Q&A, where you get to win some really exciting prizes. And today you get to win some really cool tumblers. So who wants to win? Let us know in the comment section. And stay tuned all the way to the end so that we can ask you the questions and you might just be lucky, the lucky winner, in fact. Yeah. Now, all this is happening right here on Doctors Go Live with me, Nina, and our special guest for today. Now, are you always sneezing, or is your nose constantly blocked? And if you think it might just be the flu, well, I'm here to tell you it might be more than that. In today's episode of Doctors Go Live, we're going to be talking about allergic rhinitis and sinusitis, two of the commonly, it's pretty common, but highly misunderstood conditions. And joining us today is Dr. Adillah Lamry, ENT specialist from Columbia Asia Hospital, Tebrau, and she will help us figure out why your flu never seems to go away, when it's time to see a doctor, and how you can finally breathe free. So grab your notepad, or maybe just pay extra close attention, or stay to the end, and you might just win our special quiz prizes, which is a tumbler. And if you know someone whose child, or maybe even they, are suffering from flu or allergic rhinitis or sinusitis, or this information will be really useful, please make sure you tag them. It might just make a difference to somebody out there, right? Tag your friends, follow us on social media, because this episode is definitely going to make a difference. Before we go to the next section, let's take a look at this video.
Blocked nose, sneezing fit, facial pressure. Most people assume these are just colds, but what if they're not? Millions suffer silently from allergic rhinitis and sinusitis, conditions that are often misdiagnosed and mistreated. Good news is, with the right diagnosis and care, these conditions are very treatable and relief is possible. I'm Dr. Nur Adillah Lamry, consultant ENT head and neck surgeon for Columbia Asia Hospital, Tebrau. Join me in the next episode of Doctors Go Live, where I explain how to tell the difference between allergic rhinitis and sinusitis, share the key symptoms to look for, and walk you through simple, effective treatment options. It's all happening on Thursday, 4th September 2025 at 3 p.m. Don't miss it, because breathing better means living better.
Welcome back. You just heard it from Dr. Adillah herself. You're watching Doctors Go Live with me, Nina Shahrukh Khan, and today we're diving into something that affects millions but often goes undiagnosed, which is understanding allergic rhinitis and sinusitis. And here to help us clear up the air, quite literally, is our amazing guest, Dr. Nur Adillah Lamry, consultant ENT head and neck surgeon, all the way from Columbia Asia Hospital, Tebrau. Dr. Adillah, welcome to the show. Hi. Okay, let's unmute Doc. Hang on, yeah. Could our backstage people help? All right,
Okay.
There you go. All right, welcome.
Yes, thank you.
It seems like everybody is muted right at the start today, but never mind. Now we can hear you. Welcome to the show. Thank you so much for joining us. All right. Doc, before we jump into all the juicy questions, just a reminder to all those tuning in, we have our Doctors Go Live quiz at the end of the Q&A, where you get to win a chance. You get to win some really special prizes. Today it happens to be tumblers, so be sure to listen to everything that Dr. Adillah has to share because you could be the lucky winner. All right. So if you have any burning questions about sinus, sneezing, rhinitis, allergies, or anything ENT related, please drop your questions in the comment and we will answer it after the Q&A session. All right. So, Doc, welcome. Can you please share with us a little bit about yourself and your work as an ENT specialist? What does ENT mean? Some of us, for me, ENT was entertainment, right? So maybe share with us, Doc.
Okay, good afternoon, everyone. So I'm Dr. Nur Adillah. I'm an ENT specialist. Simply means I treat problems of the ear, nose, and throat. So I'm currently practicing at Columbia Asia Hospital Tebrau, Johor Bahru, and most of my patients came with nose block, sinus problem, allergies, ear infection. So, in my 15 years of working experience, this kind of symptoms always come every week, every day we see in and out. So my aim is to help more people, breathe better, hear better, and feel better in their daily life.
Okay, awesome. So this seems to be a condition that a lot of people are not aware of. Yeah, right, Doc? How did you get started ENT and how did you end up being ENT? Was it something you always dreamt of or how?
Okay. I started in emergency department. I work in emergency department before. So as we deal with trauma cases, I see a lot of airway trauma, airways, diseases. So that kind of veered me towards ear, nose, and throat eventually.
I see. And to what you end up doing now. Lah. Okay. So today we are going to
Yes.
be talking about allergic rhinitis and sinusitis. I think let's start with the basic, yeah, Doc. Is this a condition or is it part of the human anatomy? Because I hear people say, oh, I have sinus. So is that a medical condition or is that part of the body? And is it the same with rhinitis? So, please help share with us here, Doc.
Yes, people tend to, use the term sinus and sinusitis interchangeably, right? I have
Uh-huh.
sinus. Yeah, everyone
Mm,
has sinus, but do
mm,
you have sinusitis, which is the inflammation or infection of the sinus?
mhm.
So, sinus is just our anatomy, part of our body, and sinusitis is the infection of it. Same goes with rhinitis. Rhinitis is a medical term of nose,
Okay.
inflammation of the nose. Rhino means nose. Rhinitis, inflammation of the nose. Okay.
Okay.
So
Got it.
okay. So like this slide is
Mm-hmm.
a bit of recap on the anatomy.
Mm-hmm.
The nose is just an organ in the face. It acts as a main passageway for the air for us to breathe. And the sinuses is actually an air fluid spaces in our skull. It open up into the nose. So whatever mucus or air inside the sinus will go through the nose and eventually out.
Okay. So the sinus is those spaces, right? At the top and
Yeah.
at the side of the nose. Is that
Yeah.
right?
We have
Okay.
we have like four pairs of it in the
Uh-huh.
cheek, between the eyes, behind the eyes, and in our forehead. So
Wow. Okay. No wonder people get headache from it as well, right? Because of that lah. Okay. Wonderful. Okay. So
yes,
now I know it's an organ. So if everybody has sinus, everybody has rhinus.
rhino,
Right.
right,
Yeah. But
rhino.
rhino, sorry, it's like the bada, is it? Okay. But if you have a condition, so it's called rhinositis and sinusitis. So,
Yes, yes, that's
okay,
correct.
wonderful. Okay. All right. So why are we talking? Let me see what's the next slide. Okay. So do you want to add anything to it? Yeah, Doc, with this slide.
Okay, so this is just a slide detailing about the function of each nose and the sinuses.
Mm-hmm.
Okay, the nose is the main passage of inhaled air. It warm and moisten and clean our air before it goes to the lungs. Okay, so our air outside air is very dry. It's quite tajam lah. So
Mm,
the nose will warm it up, moisten it before it goes to the lung. And also a very important organ for olfaction, which is smell. Okay, but the sinuses, it act macam kawan at the end, at the each side of it, right? It also warm, moisten, and clean the air, and it also produce mucus. This mucus will trap dust and organisms like bacteria and viruses, and try to help fight it before it is inhaled. And also one of the function of the sinuses is to lighten the skull. Otherwise, our skull will be very heavy.
I
So these
see. Okay.
air-filled spaces lighten it up.
Okay, got it. Okay, so those are the functions of the sinus, the rhino and the sinus lah. Okay, right. So for today's episode, yeah, Doc, why is it important that we talk about allergic rhinitis and sinusitis? What is it that a lot of people don't know that you know?
Okay, so because based on studies, allergic rhinitis affect more than 15 to 25% of population. Some studies cited it as up to 40%, and it is more in children and adolescents. So allergic rhinitis, when sinusitis, which is basically sinus problem, affect around 8% of population, which is more in adult. So that is quite a number of people affected by rhinitis and sinusitis. And most of the population will, they think it's just a cold, just a simple cold. They don't get treated for it. Oh, it will go away after a while. So they tend to ignore it, and then it can lead to complications. So if you recognize the symptoms early, get treated early, we can avoid all these complications later.
Wow. So a lot of people think it's a common cold lah, yeah? Okay, got it. And why is it actually more common in children? Why is that? And do we grow out of it? Just wondering.
Okay. Yes, allergic rhinitis usually presented more commonly in children because their immune system are still developing. So, and also it is time for them to venture into the world. They start to go to school, they start to go to playground, interact with people, and they are exposed to more environmental allergens like pollen and dust mites and cat danders or dogs' fur, right? And since their immune system is still immature, it tends to overreact to this substance, normal daily substances. They think it's something harmful, right? So in turns, the body will produce something to fight off these substances that they recognize as harmful. But it's actually just, our normal household substances, like dust, probably a bit of
Right.
food.
Okay.
So they
So
think it's harmful, so they react to it.
I see. And so I guess, do a lot of people grow out of it? I mean, children wise?
Okay, usually we tend to manage our environmental substances better. I mean, we tend to, as we grow older, we know what to avoid and how to manage it, have better hygiene, I guess, right? So eventually you tend to have better control over it. But we do have adult cases who get allergic later in life. The shift in the immune system, they can get allergic at adolescent or even young adults. So that tend
Wow.
to happen also.
Okay, didn't think about that, but okay, that's a very interesting thing. All right, so let's go straight into the details then, Doc. What exactly is sinusitis? What causes it?
Okay, sinusitis is inflammation of the sinus. Okay, means there is infection or inflammation. Okay, there are multifactorial factors that can contribute to sinusitis. One of it is when you have allergic rhinitis itself, your nose is sensitive. They tend to produce all this mucus, and then it predisposes to sinusitis later. All right, because when they have a lot of secretion, it doesn't come out, it gets stuck in the nose. It is a breeding ground for bacteria. So later
Okay.
they get sinusitis. Also, if you have certain habits like smoking, it also can predispose to infection of the sinus. If you have a growth in your nose, like a nasal polyp, or even if your nose is a bit deviated inside the nose, is crooked, the nose is smaller, or you say block nose, right? It also predisposed to sinusitis. And then if you have certain conditions, certain medical condition like diabetes mellitus, where your immune system is low, also predispose you to sinusitis.
Right. Okay. So sinusitis is actually the inflammation of the sinus. Yeah. Got it.
Yeah.
So what is then allergic rhinitis?
Okay. People call it hidung sensitive. Malay community, hidung always sensitive, or nasal allergies, or Chinese always say mingkan, right? And then
Oh,
it's actually it's triggered usually by dust mite. 80% of the population in Malaysia usually triggered by dust mites. Some also triggered by pets, pollen, or food like seafood. Okay, but each people have different triggering
si-
factor. So
I see.
your allergies and your neighbor's allergy might not be the same, right? So
Mm,
sometimes they say, I have allergy, don't eat that crab, don't eat that prawn. But that person don't have the allergy to prawn. They may have allergies to dust mite. So why limit yourself? All right,
okay.
so don't follow
True.
other people's allergies, right?
Follow yours.
You have to, yes, follow yours. You have to identify what you can and you cannot, right? And the most common symptoms are frequent sneezing, runny nose, itchy nose, sometimes itchy throat, itchy eyes, itchy ears, and also watery eyes. All
Okay.
these
Okay.
are common symptom of allergic rhinitis.
All right. So basically, when we talk about allergic rhinitis, is basically people with very sensitive nose that anything can
Yes.
trigger it, and they'll get like sneezing, runny nose, all that. Yeah. Okay. Got it.
Yes.
Okay. Now we're going back to sinusitis. What are the symptoms for
Mhm.
sinusitis? Is it the same as allergic rhinitis, or is it different?
Okay, some symptoms overlap. For example, nasal congestion, runny nose, it overlap with the infection of the sinuses.
Mhm.
However, for sinusitis, we have
Symptom.
extra symptom. For example, facial pain, facial pressure, especially at the forehead, in
Mhm.
your cheeks, in between your eyes, and you also have this thick, yellowish or greenish nasal discharge. Sometimes you can't smell, loss of smell, and sometimes you have fever also.
Wow. Okay.
So this can also occur in untreated allergic rhinitis or even common cold.
Wow. Okay. So kira ni more extreme punya symptoms lah. Yeah.
Yes. Mm-mm.
Okay. When is it time to see a doctor or an ENT? Just wondering, because a lot of people, as you say, seem to ignore it, right?
Okay. Sometimes you think it's common cold, right? Right.
Ah,
But common cold usually resolve within 5 to 7 days.
five
If
to seven
it
days. Okay.
yes, if it lasts more than 10 days, and then if your runny nose initially is the clear discharge and become yellowish or greenish and associated with all this fever, headache, then you might have sinusitis, and it's time to get it checked out.
All right. I'm just going to remind to our viewers out there, if you have any questions regarding this topic, please let us know in the comment section, and we'll be able to get Doc, our expert, to answer it. Okay. So this is sinusitis. Okay. Let's take a look at the next slide. Okay, Doc. So how does it impact an individual's life? If we have either allergic rhinitis or sinusitis, how does it impact a person's life?
Okay. With in particular to children, usually they don't really convey the symptoms well, but you can see it from their day-to-day behavior. They have disrupted sleep. They can't focus in class. Some have poor academic performances. Sometimes the teacher complain, this child cannot focus. This child don't want to pay attention in class, and sometimes they feel very tired, they cannot participate in sport itself. Children are very active, right? When they start to
Mm,
exhibit all these lethargic symptoms, then it's time to get it checked out. for
Okay.
this allergic rhinitis or
Yeah, so
sinusitis.
maybe we thought the child is not smart, whatever, but actually it could be due to allergy, kind of
Yes.
thing, and because it impacts and drains the energy out of anyone, right? What about like adults? How does it impact adults?
Okay, adults, yeah, because when they have sinusitis, they can't sleep well. So usually, their quality of sleep is not there. They tend so at work during daytime they have chronic fatigue. They have poor work performances, even micro sleep during driving the car.
That's pretty dangerous.
And they don't want to socialize particular time the time. So yeah, social withdrawal also is a sign of sinusitis or allergic rhinitis.
Wow. Okay. Social withdrawal. In your in the cases that you've seen here, doc, do you have any cases that you could share that someone who did not know maybe that they had this situation at the time, or anything you can share?
Yeah, I had a couple came in few weeks ago.
Mm-hmm.
The wife had a very bad allergies, very bad nasal congestion, snoring, can't sleep well. So they came to me. I did some scope. It was very the nose is very obstructed, swollen. Okay, we give some medication. I did some sinus surgery, and at 6 weeks after that, I saw the couple again. They actually came in very jovial, very happy. The
Wow.
wife
Okay.
can sleep. The wife can sleep well. In turn, the husband also can sleep well because doesn't have to hear the wife snoring. So both of them have a very good sleep.
Uh-huh.
And in turns, daytime also they feel very refreshed. And actually, they came in initially like a grumpy couple. By the end of 6 weeks, they become jovial.
Wow. Okay. So how
So that
old are
one
they?
is
How long
yes,
has he been living with it without realizing it?
yeah, it was a few months, I think.
Oh,
It
a
was a
few
young
months.
couple, 30
Uh-huh.
plus, young couple.
Okay.
Hmm.
And you mean the condition started a few months sahaja, is it? Or before that pun dah ada?
It was, yes, but it was mild symptom, not
Right.
really
Okay.
affecting. But within the past few months, it was getting worse before they finally came and see me. Mm.
Wow. Okay, okay. So if you are being grumpy with your partner, lack of sleep, you never know. You could be having this. So better go and see Dr. Adillah or your closest ENT, all right? Right. Let's take a look at the next slide. Okay. So what about, so now that we know what allergic rhinitis and sinusitis is and how it can really impact a person's life, maybe could you walk us through some of the treatment options for both? Are they the same or are they different?
Okay, some treatment are the same, but in particular for allergic, the first of all is we need to avoid the allergen. First, you need to know what are the allergens that you're allergic to. So how we know it is by observation, how you react to certain things, or you can easily get an allergic test at your nearest clinic or even nearest hospital. Get an allergic test and
Mm-hmm.
see what the test came out, what the test tell you what you're allergic to, and then from there we can uh, we can personalize your treatment. The general treatment are usually antihistamine, ubat sesama, nasal
Mm-hmm.
sprays to open up your nose. But uh, to personalize to personalize your treatment, it depends on your allergic test. If you're allergic to dust mite, for example, we do have immunotherapy for that. Up to more than 5 years old, we can give immunotherapy where you can just spray the immunotherapy below your tongue, and you will develop your body will try to desensitize uh, your immune system to the allergen. Yeah, so that one
Mm.
is for allergic rhinitis. But for sinusitis is inflammation or infection of the sinus, right? So in common with allergic rhinitis treatment, we do have antihistamine and nasal spray. But sometimes if the infection is due to bacteria, we can add on antibiotic antibiotic to kill off bacteria and relieve the pressure symptom or the pus or an infection inside your sinus. And if it's recurrent or if it's very severe sinusitis, we do have the option of doing surgery to
Mm.
suck out all the pus inside your sinus.
Oh, okay, got it. Surgery, for surgery, just wondering, ada tak it involves kind of reconstructive because maybe the shape of the nose is what is causing the
Okay.
stuck? Just wondering.
As per our slide before, one of
Mm.
the contributing factor for the sinus is, the different anatomy, the deviated septum, or even the polyp, the
Mm.
obstruction inside the nose. So we will do a CT scan first. We will
Mm.
do a scope, see how is it inside, how blocked is it, if there are deviated septum, and also we will do a CT scan. And based on the finding, if you have deviated septum, of course, we will correct it, open up the sinuses. If you have enlarged turbinates or enlarged structures inside the nose, we can also shrink it so that
Mm-hmm.
the circulation of the sinuses is can be improved. Okay, some
Okay.
people scared of this sinus surgery. Oh my God, surgery, right?
Yeah, it sounds
A
scary.
bit,
Yeah.
but it's minimally invasive because we use a camera. We use a camera, go inside your nose, and everything, all the surgery will be done inside the nose. There's no external scarring. So, and
Okay.
yeah, it is
So,
done under general anesthesia. You are totally asleep, painless surgery, no external wound, and by the time you wake up, it's done.
okay. So it's basically your hidung still looks the same, lah. It's all done internally, correct?
Yeah, 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 yeah.
So
We
there's
don't
no
touch the
chance
external
of
thing.
you having a K-pop, like a really nice nose after that. Just
That
wondering.
one is additional. That one is
Okay,
additional charges.
additional charges, but it is possible. So you might want to consider that, yeah, kind of thing. All right, cool. So is there a lot of surgery cases in Malaysia? Just wondering because of allergic rhinitis or sinusitis.
It's quite common. This is a quite common condition, and the surgery is also quite common. For example, this week alone, I already have 3 to 4 cases of sinusitis. Uh,
Wow.
Three
Okay.
out of four is going for surgery, right?
Okay.
And so far, they're doing well.
Mm-hmm.
It is a common procedure, so
Tak perlu
it
takut.
usually tak perlu takut, and it's
Okay.
actually not that big of a procedure also. It only around 1 hour plus 2 hours of surgery.
Okay.
Yeah.
And is it like a day in and check out or overnight kind of thing procedure? Just
Uh,
wondering.
no, unfortunately, we need to monitor you post-operative. So usually, you need to be warded around 2 to 3 days.
Okay, what it two
Two
to
to
three
three
days.
days.
Okay, sounds
Yep.
cool. But you'll be breathing better, and it's pretty common. So okay, kind of thing. So these are the treatment options, yeah, doc.
Yes, to recap, yeah,
Mm-hmm.
the pills are antihistamine. We have an option of drowsy or non-drowsy antihistamine. The newer generation of antihistamine are usually non-drowsy, so there is no issue of taking it during the day.
Mm-hmm.
And then we also have intranasal steroid spray. Some people are scared because, oh my God, steroid, you're giving me steroids, right? But it's
Yep.
actually only topical, meaning just spray. It doesn't get absorbed into your blood circulation. So we avoid the usual side effect of steroids. And it is also can be taken for many years. Some drugs have a good safety profile of 5 to 7 years, can be taken without minimal, very, very minimal side effect or no effect at all. And
Mm-hmm.
then we also nowadays, a lot of drug company came up with a spray that combines steroids and antihistamine, meaning you don't have to
Mm-hmm.
take antihistamine through mouth anymore. You just spray and it delivers steroid and antihistamine at once. Uh,
Wow.
and
Okay. Okay.
then Yeah. And also we have salt water or saline spray. This one is just to flush out all the thick mucus inside the nose. It
Mm-hmm.
flush out, and then so that your nose is a bit uh will get drier. Yeah, it
Okay.
get roomy. It
Mm-hmm.
becomes roomy and drier.
Okay, and this is natural lah, kind of thing, because it's just
Salt
salt
water.
water, right?
Yes, salt water.
Okay.
Yes.
Very, very apa ni, effective.
Yeah, a lot of people sometimes because they, especially the saltwater saline, they don't know we have this option. So first time people using it, they say, oh, they have a lot of improvement. Suddenly, all the mucus came out, and they see the mucus, the yellowish, greenish
Mm-hmm.
mucus came out, and they get very excited because they're, oh my god, a lot of they didn't realize that the nose is harboring a lot of thick mucus. So when they flush it out, baru dia nampak macam yang, there's a lot.
Wow. Okay. And is it painful, doc? Because it goes in the nose and stuff. So, psychologically, I'd be freaking out. Is it painful? Just wondering.
No, no. Usually we use low pressure, high volume bottles. Means even though you think the bottle is quite like around 200 cc, 200 ml of water being sprayed into your nose, but it's actually low volume. So it doesn't have the pressure effect.
Okay.
With the correct technique, it flow pretty seamlessly.
Okay. Tak adalah yang macam headache, macam tu. Tak ada, doc?
Usually, no, no. And there's a lot of tutorial in YouTube also. How to
Okay, there
use
you
the
go.
salt water is,
Yeah, don't be
yes.
like me. Don't be scared by the sound of things going in your nose. It's actually very gentle. Yeah, doc? Kind of thing. All right. All right. So we've come to the end of the slide. So, Doc, what is the one thing that you want people to stop doing or ignoring when it comes to nose health or when it comes to this topic?
Okay, when it comes to this topic, of course, I don't want patient to ignore persistent symptom. Sometimes
Mm-hmm.
you think, alah ini biasalah, dari kecil dah ada,
Kan?
biasa je, nanti it will go away. But
Mhm.
I seen cases where they ignore it for months and then it become complicated condition. The pus from the sinus itself goes into the eye, and the eye swollen, the eye is full of pus, and that patient lost
Eyesight.
vision,
Oh
lost his
dear.
eyesight because of the
How old
infection.
was the patient, if you don't mind me
He
asking?
was a young adult, I think around 19 years old.
Wow. And what
18,
was the reason
19.
for not taking action? Just wondering.
He thought it is common cold. Biasalah tu, hidung,
Oh,
biasalah.
right. Until it impacted the vision, yeah?
Yes,
Okay. But there
yes.
was pus, right? Uh,
Yeah, yeah,
there was
yeah.
pus inside, but I
Uh,
guess cannot tell there was pus.
Uh, that he did have some yellowish discharge, but also he tend to ignore it.
Right. Okay. Okay. So
Mm.
because it sounds like a normal cold, right? So I guess what we
Mm.
need to be mindful of, or what the take-home message is, if you see, colds lasting more than 5 to 6 days, as you mentioned, doc, please go to the doctor,
More than 10 days.
especially when
Yeah.
it, yeah, starts getting discharged and stuff like that, because it could
Mhm.
impact the your other senses, for example, your eyes, because
Mm.
semua connected kan, doc?
Yeah,
You,
it's very close to the eyes, very close to your brain also. It can goes to the brain and cause brain infection, someone, goes to the ear.
epilepsy. Yeah, okay. So,
Yes, yes.
especially for parents, please do not take this for granted. Anything more than 5 6 years, 5 6 years old, like anything more than 5 6 days,
7 days.
please bring the kid to clinic or to hospital. Doc, which one?
Yeah, either way also can.
Either way, also can. Okay, cool.
Yeah.
And if someone has a blocked nose for weeks, how long is it too long before they should seek help? Just so people are aware the gravity of the situation.
Your nose block shouldn't last more than 10 days.
More than 10 days, what can happen, ya, doc? Bagi
Yeah,
scary scenario.
sinusitis.
Sinusitis. There you go.
Sinusitis. We've seen a lot. More than
Okay.
10 days, then you get accumulation of pus inside the sinuses, and then some of the pus trickle down the throat and goes to the lung, and they get lung infection.
Wow.
They get
Okay, so you can
admitted for
get brain
lung infection,
infection, lung infection, eye
eye infection.
vision gone. Mm.
Mm-hmm.
The
Yeah,
one with the
so
kid, what happened to the eye? Was it able to be restored or lost vision?
unfortunately, he lost the eyesight. Yes, he
Wow.
lost the vision. He only have one now.
Okay.
Mm.
Mm. Okay. So, Doc, in your experience, any other memorable cases of someone who ignored their symptoms too long, or maybe there are other cases you could share with us?
Not particular, not related to sinusitis itself, but
Mm.
I have this one uncle just came in for epistaxis, just bleeding from
Okay.
the nose, very mild, very just a little bit of epistaxis. He initially doesn't want to come,
Okay.
but his wife made him, so he
Uh-huh.
just
Okay.
came see me. All right,
Mm-hmm.
and I scope, when did a CT scan, it turned out to be nasopharyngeal cancer. It's a
Ooh,
cancer.
okay.
But
Okay.
because he came early at the slightest symptoms, and we caught it at a very early stage, stage one.
Mm,
So,
okay.
yeah.
Okay.
So,
So
with
this is
stage one
this
cancer, it's very treatable.
okay. So this is nose bleeding, yeah.
Yes, nose
Yeah,
bleeding.
that kind of dried up, I guess. Does it dry up or it
Uh,
just continuously
Yeah,
bleed?
no, it dry up. He just had like a few episode of it, just spotting, just minimal bleeding,
Okay.
1 to 2 times, and then he came and see me. Yeah.
Okay. So there you have it. Bleeding also, just go and see. Don't wait too long. Because stage one is extremely easy kind of thing. And now a lot of
Yes.
people recover from
Yes.
cancer as well, right, Doc? It's not
Yes.
as disastrous or
Mm.
life threatening as it's people think it is. Okay, thank you, Doc.
Yes.
And what's your advice to people who are nervous about seeing an ENT or, seeing a nose specialist? Ada tak, Doc, orang takut jumpa
I do
you?
a lot. They
So
have
what's your
this
advice?
they have this misconception kalau jumpa ENT, and then ENT
Surgery.
doctor will put a camera scope, it is very painful, then doctor will suruh operation surgery, also they scared of it. Okay, actually, of course, when you see ENT, we put a camera inside, but it's actually pretty painless procedure. We usually they say it's not painful, probably rasa macam nak bersin saja. Okay.
Ah,
And
okay.
then if you're scared of it, we also have numbing agent. We have numbing sprays. You can spray inside your nose and you won't feel a thing. Just
Okay, okay,
a quick camera inside, in and out. Probably not even 2 minutes. 1 minute, one
okay.
minute plus.
All right. So just be aware that you if you see an ENT, not semua kena masuk kamera. Kalau kena masuk kamera pun it's okay. It's not that big, right? It's small. It's like a
Yes.
sneeze. Yeah, and there's numbing
And
spray,
tak
so you're safe.
semestinya kena surgery. Not everything we cut. If it
Yes, not
can,
everything is
yeah.
surgery.
Yes,
And even
if it
with surgery,
can,
it's quite common, right? Yeah.
yes.
Okay, got it. All right. So if we were to summarize everything here, Doc, what's the most important takeaway from today's episode?
Uh, the take-home message today: allergic rhinitis and sinusitis are very common but very treatable. Don't ignore your persistent symptom. And healthy nose, better breathing, better life.
All right. Okay. And early treatment, right? Prevents everything from getting worse,
Yes, early
including
treatment
nose
prevents
cancer.
complication. Yes.
Yes. Okay. So just pergi and tengok. And if there's one thing that everyone who's watching today, what can they do to protect their nose or sinus health? If there's one thing that they can do, what would it be?
Oh, prevention. Prevention is the
Prevention.
one thing that is very important. Yeah.
Okay.
If you have
When we talk about
allergies,
prevention,
pre- mm, if you
that
have
means
allergies, prevent the thing that provoke it. For example, you're allergic to, if, for example, you're allergic to dust mite, don't
Yes.
go to, dusty places. If you're allergic to prawn, don't go and eat that prawn. Okay. If you go to, for sinusitis, if you go to public places, please wear a mask, right? Have a good hand hygiene, prevent cross infections, and you can prevent most of the infections by that.
All right. Awesome. Okay. So there you have it, ladies and gentlemen. Super insightful session. What are some of the biggest learning that you had today, shared by Dr. Nurul? Please let us know in the comment section. For me, prevention kind of thing. So clean your room if you're messy and you're allergic to dust mites. All right. So let's get into some Q&A. Yeah, Doc. Okay. You can, let me just remove the slides. Okay, cool. So, Doc, question from Yvonne Chang Ai Hua. Doc, usually people with sinus can't smell a lot of things. Yeah, ke, Doc?
Okay. If the sinusitis cause inflammation of the nose, yes, your nose get blocked. Yes, you can't smell some things. Okay, you
Okay,
probably have a reduced sense of smell. Yeah, if your
okay.
nose is
But
blocked.
once
Not
it's,
necessarily not necessarily sinusitis. If you have a very bad allergic rhinitis also, you probably
okay,
can't smell some things.
when we have it, lah, is it? When we have it,
Yes.
okay. But if we don't have it, it should be quite okay, right?
Yeah, yeah.
Okay.
If you don't have anything else, for example, you don't get involved in trauma, there's no patah-patah or some facial bone fracture, right?
Ah,
So you're supposed to smell.
yeah, you're supposed to smell, yeah, just in case kind of thing. Kot lah, some people don't smell durian or black guy. Okay, Yvonne's ni bukan question, but it's actually a statement which I found quite interesting. I got sinus only after I got COVID in 2021. Is that possible, Doc, that you get sinus only after a COVID incident?
Yeah, certain viral infection do predispose to a shift in the immune system that can cause allergic rhinitis later, or even sinus infection later.
Right. So that was like a shift in the immune system, I guess. Yeah.
Yeah.
Okay, cool. Next question is from Yiki. What are the warning signs that symptoms of these diseases are becoming more serious? So, how long should the symptoms last before seeing an ENT? Good question.
Okay. The symptoms, more than 10 days, please see an ENT. Okay. The warning signs. Warning signs,
Ah,
if your mucus start to get yellowish, greenish, become thick, if you have a very bad headache, facial heaviness, if you have high fever, or if your eyes have become swollen, please, these are the warning signs. Please come to
okay.
see ENT.
So that is already quite serious, lah, I guess. Okay,
Mm-hmm.
got it. This one's just a statement. Maya Chari, Trihalim. Yes, when my sinusitis came, I had very bad headache on my cheek, under eyes, forehead, my eyes. So these were the symptoms you were talking about. So
Yeah.
time to go and see Doc Nurul lah, Maya Chari, masa when that happened lah. So hopefully you manage, okay? Continuation question from Maya Chari, which is, sorry, kejap ya. Okay, good afternoon, Doc. My daughter always has blocked nose in the night when sleeping time. She also sleep with mouth open. How can I know if my daughter has allergic or not? Should I do the allergic test? Good question.
Okay, blocked nose solely blocked nose. Probably she has adenoid enlargement, meaning there's a lymph node behind your nose that are usually enlarged in children, and this cause narrowing of the airway, especially when they sleep. So when their nose is blocked, they tend to breathe through their mouth through their
Mm,
mouth. So open mouth, sleep with open mouth lah. So
mm,
how we know is by putting a small camera inside the nose and see whether it's enlarged or not.
okay.
And then
All
from
right.
there we can advise what's the treatment for it.
All right. So your advice would be to have her come and see an ENT specialist, yeah, to just to
Yeah,
check
have a
if that's the
camera.
situation.
Yeah. And from our assessment, if the doctor also have allergic rhinitis, we can suggest for allergic test. But
Okay.
come and see us to see
Okay.
the to see the
To
back
see
of the
the
nose.
nose. Okay, cool. So which
Yeah.
means bring her in, and then doc will suggest what's the next step. So thank you for that
Yes.
question. Hope that answers your question. Last question before we go for the quiz questions. Amir Saleh is asking, doc, are nasal sprays and douching safe to use long term?
Okay, there are a lot of nasal sprays in the market. Each one has different ingredients. So not all nasal sprays are the same. But if it's a steroid nasal spray, there are brands that have a good 5 to 7 safety profiles that are safe to use for long term. Douching is usually salt water, no problem in using for long term.
Okay, got it. All right. So let's take a look at our quiz questions. Yeah, it's time for the quiz. All right. So now it's time to the quiz. But before we continue with the Q&A, we've got some awesome stuff up for grabs. That is, it's time for quiz. So as mentioned earlier, as part of the show, we have some tumblers out for grabs. But what do you need to do in order to win? First, you got to be sure to share this video out 3 times, and remember to set the share post to public so that everyone can see. Number 2, answer the next questions we'll be showing on the screen in a single comment, and you are on your way to win the prizes. So let me repeat the instructions. First, share this video out 3 times, and remember to share the post to public so that everyone can see. Secondly, answer the 3 questions we will show in a single comment, and we will select the first 3 winners based on the correct answers and share it first. So are you ready? Let us know in the comment section. Okay, so if you are, let's find out what the quiz questions are. So the first question is, sinusitis and allergic rhinitis are the same thing, true or false? Sinusitis and allergic rhinitis are the same thing, true or false? Next question, facial pain and pressure are symptoms of sinusitis, true or false? Facial pain and pressure are symptoms of sinusitis, true or false? Question number 3, all nasal conditions require surgery. All nasal conditions require surgery. True or false? So do give us the answers in a single comment, and we're going to select the first 3 winners based on the correct answers and share it post. In the meanwhile, we're going to go back to our Q&A from each and every one of you. Yeah, let me remove that. All right. Doc, are you ready for the next Q&A? Where people are giving
Yes.
their quiz answers? Okay, it's from Atira, who is asking, can tablet desloratadine and Nasonex spray be used for long term?
Yeah, can. The Loratadine and snacks are safe to use for a long term, but with like any other condition or disease, we aim to eventually wean you off all this medication, right? With
Okay.
the control of environment, controls of your allergies, eventually we want to wean you off. We don't want you to get dependent on these sprays and medicine, right? So eventually, after a while, we need to stop it
Okay,
and
wonderful. All
only
right.
use it
Only use it for short to medium term.
when
Yeah.
yes.
Okay, so next question is from Yiki as well. Will air conditioning or fan trigger symptoms? Ada tak, Doc?
Ada, selalu juga. Sometimes it's your reaction, your nose reaction to cool environment that triggers all this nasal symptom. And sometimes it can also because of dust. You know, fans, the tepi-tepi tu ada habuk kan.
Yes,
That one
correct.
can also triggers. Yeah, bila you
Mm-hmm.
buka and then all the habuk-habuk go inside your nose, it triggers the symptom also. And sometimes the filter inside the air condition, if you don't, service it, orang service for quite sometimes, the dust will build up and then it can cause a reaction also.
Okay. Doc, what about water masuk hidung pun boleh trigger, right? For those sensitive noses, start sneezing and stuff like that. Ada ke, Doc?
Water masuk hidung ah.
Sebab dia sensitif. Never heard.
Okay.
Mm.
Selalunya tak ada lah. Probably chlorine water lah kan. When you
Okay,
sleep,
yeah. All
dekat pool
water
or
is
something like
chlorine
that.
kan?
Yeah.
Kind of thing. Okay, makes sense. Okay, so Amir Saleh's next question is also, Doc, are there side effects of using nasal sprays too often? I think this is similar question, but let's hear it from you.
Yeah, okay. Essentially, it's quite safe, but with like any other medicine also, they tend to have side effects. For example, when you use for a long term, your nose become too dry. Too dry, it tends to get epistaxis, bleeding from the nose.
Okay,
Mm-hmm.
so that is what happens on the side effects.
Mm-mm. Some
Okay,
side effect.
some side effect. Is it very common with people or just very severe?
Not really, not really.
Okay. Okay, so it's not even really, so pretty safe lah. Next question from Nikki. If we are using an air purifier at home, will it help with the condition? Does air
Yes.
purifier really help? It does.
Yes, it
Okay.
does. It does.
Okay.
It cleans the air, make you less susceptible to environmental allergens.
Okay. In fact, in your experience, yeah, doc, let's say people are allergic to dust mites. What are the things that are effective that they do that helps?
Okay, first of all, the dust mite is prominent in our beddings, our blankets, our bed sheet, pillowcase, even bantal busuk, soft toys, teddy bears, because this is the place where we spend a good 6 to 8 hours, right, during sleeping. So when we sleep, our dead cells from the skin will jatuh dekat all these beddings, and it is the food for the dust mites, so they thrive
Okay.
in this condition. Okay, so how to remove the dust mite is actually by using hot water. Sometimes they say I sudah basuh every 2 weeks, saya tukar doktor, tapi sama je, right? Sometimes you need to soak it in hot water because dust mite die at around 60 to 70 degrees Celsius of temperature.
Okay.
So soak it in hot water first, then you can wash as usual.
Okay. So that actually works, yeah. What about the young all these pencuci yang 99% bacteria and stuff like that? It still doesn't work. Hot water is the best, is it?
Yeah, hot water, dust mites.
Okay.
That's
And
what
what about
particularly,
when
yes.
you're cleaning rooms, especially rumah lama? There's those you feel gatal-gatal when you clean. Those are dust mites juga ke macam mana?
I think so, yeah. Probably ada juga
Okay.
hot dust.
So how do you
Yeah.
clean those rooms yang, because they're not really bed sheet
Yeah.
kan? It's in the air. So would that be the apa tu
Itu
yang
ada
the
dust
previous?
mite and probably just general dust lah kan, habuk biasa
Okay.
lah. Alright.
Okay.
But if you have allergies and you need to clean those rooms, just make sure you use proper protection, wear mask, okay? And then when you're done cleaning it, have good proper hand hygiene, wash your hands properly, and then baru you sentuh your face lah.
Okay, so we're going to answer two more questions before we reveal the winners. Yeah, does the color of the mucus show if an allergy, cold, or sinus infection, or it shows the
Okay.
stages of it? Yeah.
Yeah, allergy. The mucus of allergy usually colorless and it's thin. Okay.
Okay.
But for sinus infection, usually discolored already. Same like cold, but cold because of viral infection also have colorless, thin kind of mucus. But if it's already has super added bacterial infection, it will get thicker and yellowish greenish.
Okay, and that's the time where we got to come in and go and see a doctor, right? Okay, last question before we reveal the answers for the quiz, the winners actually. So Yiki's question is, why do we feel tired and sleepy whenever we have allergic sinus issues or flu? Betul. Because lalu macam makan ubat, we even though tak makan ubat, but sleepy, stone je kan.
And you know,
Kenapa nak?
Okay, when your nose is congested, you can't breathe properly through your nose. Okay, so when you sleep, you don't get enough oxygen. There's not enough
Okay.
oxygen going to your brain when you sleep because of the nose congestion. So you don't have that quality sleep. You don't get
I
that deep sleep.
see. Okay.
So you punya tidur tak quality. When you wake up, you feel not fresh. You feel lethargic. You feel a bit
Okay.
headache. Susah nak bangun. Yeah.
But also when we get our allergies, we feel sleepy, right? And tired. Why does that happen? The other way.
Same. Because you didn't get enough sleep, enough quality sleep at
Okay,
night
got it.
because of the
Okay.
allergies. Yes.
Okay, got it. All right. Thank you, Doc. That is basically all the questions we've got. And now, how many of you guys would like to know if you are the winner? Let us know in the comment section. But before we reveal the winners, let's take a look at the quiz questions and what the correct answers are. Yeah. So for that, I will need your help, Doc. Boleh tak, Doc?
Okay.
Okay, so
Right.
first question: sinusitis and allergic rhinitis are the same thing. True or false, Doc?
False.
False. Okay, it's not the same thing. All right. Facial pain and pressure are symptoms of sinusitis. True or false, Doc?
True.
Yeah, because the sinus is affects like the head area and the area between the nose, right? Okay. And the third statement is all nasal conditions require surgery. Doc, true or false?
Not true.
Not true. So
False.
we can definitely tell you a lot of people don't go and see doc because they're scared of surgery, but that is not true. You don't need, not all conditions require surgery. Yeah, doc?
Yes.
All right. Congratulations if you got the right answer. So the right answer is false, true, false. And let's find out who our winners are. And our winners are Yvonne Chang Aihua, Elvin Lam, Flora Connie. Congratulations to our winners. What's going to happen is that we're going to be contacting you after this within a day to get your details. So be sure to check your Facebook Messenger inbox and we'll share with you the details. So make sure you check your Facebook Messenger inbox. All right. Thank you so much, Doc, for today. I have definitely learned a lot. Let's give Doc a round of applause, shall we? Kind of thing. All right. So that's all the time we have for today. We hope you learned a few things. And if you know someone who's really going to appreciate today's tip, info, and insights, please do share this video out. Tag them because you never know whose life you're going to make a difference to. Give us lots of love and like while you are at it. Thank you again. Till then, I am signing off as well as Dr. Nurul. Yeah. Thank you so much. Take care of each other. And we'll see you in the next episode of Doctors Go Live. Thank you. Bye.
Right.
Thanks,
Thank
Doc.
you.